COVID-19 infections in India are spreading at a rapid pace, with the fresh infections today being over 1,30,000. Now the highest single-day spike that India has seen. Amidst this and the fresh curbs being imposed by several states, many are now eager for their Suraksha Kavach, a vaccine jab. As the clamour for more vaccines grows, there's a sparring now between the centre and the states over the doses. Some states are accusing the centre of being partisan in its distribution of vaccines, and with this, the political temperatures have risen. As the centre stresses that the COVID vaccines are not in short supply, states are claiming otherwise. The UP hasn't officially complained, but some hospitals in Ghaziabad were the first few reported cases of putting out notices that vaccines are out of stock. Orissa wrote to the Health Ministry for additional allocation of vaccine doses, as nearly 50% of the vaccine centres were shut on Thursday as there were no vaccines. Today, Maharashtra Health Minister has also said that 70 out of the 120 vaccination centres in Mumbai were closed due to want of vaccines. Here's a quick roundup of how badly affected states are faring on the vaccine count.
Even as the centre continues to claim there is no shortage of vaccines, private hospitals are facing a crisis and have not carried out vaccinations this entire week. Sample this. This notice plastered outside a private hospital in Ghaziabad says they have run out of vaccine doses. Many hospitals do not have clarity on when the next stock will arrive and have pasted notices at their entrances, asking people to call them to check before they reach there.
मैं इस वक्त गाजियाबाद के इंद्रापुरम में एक अस्पताल एमी केयर के बाहर हूं और एमी केयर में आप देख सकते हैं यहाँ पर ये नोटिस बोर्ड लगाया गया है कि कोविड-19 वैक्सीन्स आर नॉट अवेलेबल इन स्टॉक, सॉरी फॉर इनकन्वीनियंस। यानी अब यहाँ पर वैक्सीन की जो डोज यहाँ पर लगती थी रोजाना वो खत्म हो गई है।
But this is not new. The outcry has come from at least a dozen states. Inoculation was halted in several parts of Maharashtra, the worst hit state.
इस समय हम खड़े हैं मुंबई के जंबो कोविड सेंटर में, जो कि मुंबई का सबसे बड़ा कोविड सेंटर है। यहाँ पर वैक्सीनेशन का जोरों शोरों से काम शुरू था, लेकिन आप देख सकते हैं कि यहाँ पर भी नोटिस चिपका दी गई है कि वैक्सीन खत्म होने की वजह से वैक्सीनेशन रोका गया है।
According to Maharashtra Health Minister Rajesh Tope, the state was left with 1.4 million doses, which would last only 3 days.
कई सेंटर जो खोले गए थे, सबके सब सेंटर बंद हो रहे हैं क्योंकि उनके पास एक दिन का भी अभी वैक्सीन नहीं रहा है।
While Maharashtra complains of acute shortage, the centre's data says that the state has the highest share in vaccinations done so far in India. Not only Maharashtra, several other states also said they are running out of vaccines and have requested the central government for replenishments. Punjab Chief Minister Captain Amarinder Singh said that at least 2 lakh daily doses should be administered in Punjab henceforth. Punjab was also among the states that sought lowering the age criteria for vaccinations. Among the other states that have alleged shortage are Odisha, which has only 3 days' worth of stock left for vaccinations. In a letter to the centre, the state has demanded more supply and said that 400 vaccination centres have been closed.
पहले तो वैक्सीन कम पड़ रहे हैं, ठीक बात नहीं है। सब राज्यों में वैक्सीन उपलब्ध कराए गए हैं और जितना चाहिए उतना उपलब्ध हो रहा है।
Beds and vaccines are in short supply in Karnataka, Telangana, Rajasthan and West Bengal as well. The Union Health Minister has categorically denied any shortage of vaccines, calling an end to fear-mongering by some states.
पिछले समय में एक भी देश के अंदर कोई व्यक्ति ये कंप्लेंट नहीं कर सकता, कोई स्टेट गवर्नमेंट या व्यवस्था के अंग, कि हमारे यहाँ पर वैक्सीन ना होने के कारण जो है यहाँ पर हमने वैक्सीनेशन बंद कर दिया।
And then yesterday, Prime Minister Modi urged states to ramp up testing and tracking, as that is the only way we can contain the second wave.
इस पीक को बहुत तेजी से नीचे ला सकते हैं, पीक को ऊपर जाते रोक भी सकते हैं, और अनुभव कहता है कि टेस्ट, ट्रैक, ट्रीट, कोविड एप्रोप्रिएट बिहेवियर और कोविड मैनेजमेंट, इन्हीं चीजों पर हमें बल देना है।
While center-state face-off continues over the supply of vaccines, top sources in the Health Ministry have told CNN News 18 that vaccines are getting replenished every third day. That's the system, and that there is no vaccine shortage whatsoever. With Bureau Inputs in New Delhi, I'm Runjhun Sharma.